Hey everyone! Today we're diving into a crucial topic: fatty liver or hepatic steatosis. It's a condition many people face, and if not taken seriously, it can lead to complications. When we think about liver problems, the first thing that often comes to mind is alcohol. And yes, excessive alcohol consumption is a villain. If you choose to drink, keep it very light, but if you can, it's best to avoid alcohol altogether. But what about fatty liver that has nothing to do with alcohol? This condition, once called non-alcoholic, now has a more precise name: metabolic dysfunction-associated steatotic liver disease, MASLD. Why the change? Because science has advanced, and we understand that the main culprit isn't necessarily the fats we eat. In the past, we thought fatty liver came from mayonnaise, bacon, fatty steaks, pork, fried foods. And surprisingly, these things actually contribute the least to MASLD. Pay attention, because fatty liver has a direct link to excess carbohydrates. That's right, sweets, excessive sugar, refined flours, lots of cakes, and breads with too much flour. I'm not radical, and I don't advocate for restrictive diets like never eat sweets or flour again, but it's essential to reduce your consumption. We know that both sugar and flour in excess aren't beneficial for our health, and for the liver, the connection is direct. Another important point is diabetes. People with diabetes have a higher predisposition to MASLD. That's why it's crucial to work with a specialist to keep blood sugar levels and glycated hemoglobin under control. And there's more. Did you know that pregnancy can also contribute to MASLD? Expectant mothers, be careful not to gain too much weight and avoid becoming completely sedentary. If your obstetrician gives the go-ahead, keep up with your physical activity. Some medications can also cause fatty liver, such as prolonged use of corticosteroids or tamoxifen, which is used in some cancer treatments. If you need to use these medications, it's vital to monitor your liver with tests. Similarly, many chemotherapy drugs can affect the liver of those undergoing cancer treatment, so it's important to pay attention to liver enzymes. Sedentary lifestyles are another risk factor. If you don't exercise, know that your risk of developing fatty liver increases. And what about extreme diets, those that make you lose weight very abruptly? Surprisingly, this can also cause MASLD. Obese individuals who already have a higher risk of fatty liver need to lose weight, yes, but in a very gradual manner. How to diagnose fatty liver? A simple abdominal ultrasound can detect fatty liver. If there are doubts about the grade, first, second, or third, more advanced exams like CT scans or magnetic resonance imaging, MRI, might be recommended. Nowadays there's an even more modern exam, magnetic resonance elastography, MRE, which can accurately calculate the degree of scarring or fibrosis, indicating the level of the disease. The gold standard diagnostic exam is a liver biopsy, but it's not indicated for everyone. It's a procedure using a needle guided by ultrasound or CT scan, which collects a small tissue sample for analysis. In addition, we have laboratory tests such as transaminases, ALT, AST, and gamma-GT. I also often request bilirubin levels. It's crucial to take fatty liver seriously. If left untreated, it can progress in grade, starting a process of scarring and fibrosis in the liver. If you continue to harm your liver, this can lead to cirrhosis and, in a smaller proportion, even liver cancer. Don't be alarmed. This happens in a small percentage of people, but it's essential to pay attention so you're not one of them. Treatment begins with lifestyle changes. First, lower your glucose and triglyceride levels. Elevated triglycerides are one of the biggest causes of MASLD. High cholesterol isn't good either, but the primary focus is on triglycerides. Reduce your consumption of sugar and refined flours. Those who are obese need to lose weight progressively, not abruptly. And pay attention. Lean people can also have fatty liver. I've seen cases of individuals who were underweight but had diets rich in alcohol and sweets, developing advanced MASLD. Invest in aerobic activity interspersed with strength training. For example, half an hour of walking combined with 3 to 4 strength training sessions per week. It's extremely important. Furthermore, some professionals use herbal medicines, such as silymarin, around 400 to 600 milligrams for at least 6 months, and associate it with vitamin E, 400 milligrams, also for at least 6 months. After this period, reevaluation is done with imaging and laboratory tests. You have all the tools to get rid of fatty liver. Start following these tips. It's a serious disease that we need to confront decisively. If this video helped you, please share it. It's important content that can make a difference in someone's life, and if you haven't liked it yet, give it a thumbs up. If you're not subscribed, subscribe to the channel. A hug to all, and God bless.